prevent fentanyl overdoses in our state.
Our Bella Caracta joins us now live in this studio to share how this proposed bill works and what was heard today in the Health and Human Services Committee.
John, Aaron, fentanyl deaths have increased every year since 2012, according to the CDC. Initiatives in the metro that 6 News has covered include the health department distributing life-saving treatment for overdose, naloxone, commonly known as Narcan, while a new initiative by State Senator Tony Vargas of Omaha looks to prevent rather than treat an overdose.
LB 1325 allows pharmacies to sell test strips that detect fentanyl. In some states, these potentially life-saving strips are considered drug paraphernalia. In others, they're not. This bill provides some clarity, says Marcia Muting with the Nebraska Pharmacists Association.
I had lots of pharmacists call me and say, "Can I sell these?" And I didn't know the answer.
She and the association support the bill that Senator Tony Vargas of Omaha has proposed.
I was encouraged to bring this bill after seeing other states' successful bipartisan efforts to enact similar legislation.
This bill would also allow but does not mandate that local health departments provide these strips for free. Senator Merv Reapy asked how much it costs per strip. $1. Senator Ben Hansen voiced some concerns which were made through online comments that oppose the bill. Those concerns being greenlighting taxpayer dollars to provide the strips. Maggie Ballard with Heartland Family Service, a nonprofit in Omaha, provided this perspective.
The flip side of that argument is saying that it's not those people that are perhaps going to die of an overdose, that they are not worth the $1 for a testing strip.
The statistics should tell enough of the story about this epidemic and what we should be doing proactively to prevent it.
6 News has spoken with multiple families in the metro who experienced a loss due to fentanyl and grapple with the preventability of fentanyl overdose, including mother Christy Wishnack, who lost her son Zach.
He definitely did not know that it was fentanyl. We get to live with that every single day, knowing that it was something that could have been avoided.
Now, at the Health and Human Services Committee, 5 people submitted online comments in opposition and 5 others submitted comments of support online. Reporting live in the studio, Bella Caracta, 6 News.
Deputy